Hey, Beyond listeners, I'm your host, Dr. Flora. Welcome back to the Beyond podcast. I'm excited for today's guest because there is a lot of misinformation about cardiac health and especially cardiac health in women. So I have brought the expert, Dr. Purvi Parwani. She is an assistant professor of medicine and director of women's heart clinic at the Loma Linda University Health. Dr. Parwani is not just a regular cardiologist, my friends. She has training in so many different things. So let me list this out for you. She has training in not only general cardiology, but taking care of patients with complex cholesterol disorders, has learned sports physiology, cardiac rehab, and prevention. Also, that's not it. She has been trained in reading cardiac imaging. She believes that cardiovascular health starts with physical and mental well-being and focuses on lifestyle modification, exercise, diet, and yoga, along with guideline-directed medical therapy and taking care of her female patients. She is well published and well known for her medical education and interventions on social media. And I am excited to have her here because we need to debunk a lot of common myths and teach everyone all about the importance of heart health in women. Hi, everyone. You are listening to Beyond, and I'm your host, Dr. Flora. Listen, life is hard. You don't have to do it alone. As a mindset coach, physician, mom, and an infertility warrior, I have mastered techniques to help move you towards contentment and growth. I can't wait to go along with this crazy-ass life journey with you while making sure you feel like your best self. This podcast is meant to have you feel unstuck from your rut and less alone. Let's do this. So, Dr. Purvi, thank you so much for being here. I'm so excited to chat with you today.
Thank you, Dr. Sinha. It's been a pleasure and honor to come on your podcast. And I'm so excited to talk about the things that I'm passionate about. So thank you for giving everyone, all my patients and their voices, voice through me, because when you hear me, you hear them.
Yes, and that's, I think, what gravitated me towards you when I heard you speak, and you speak with passion. Like you can tell that this is your purpose, and obviously you're so good and so accomplished, and I'm happy that a lot of our female patients have you as not only their doctor, but as a trusted source and guide. So let's get started. Research is mostly based off of Caucasian men. Can we trust this standard, like the standard heart health advice that we give all of our patients? Does that relate to us? Because obviously women's bodies are different.
You're absolutely right. I think for longest ever, it was thought in medical research that what women are is small men. And apart from our, breast and uterus, there is nothing else unique about it. That's what it was thought to be. But as we understand more and more, we understand that the physiology of women, the way our arteries are made, the way our organs are, the way the fat deposit is, the way our metabolism is, it is absolutely different. For years of research, was based predominantly on Caucasian men. So not just about the women, but also the minorities, etc. were also ignored. Now, the good thing is that at least in last 20, 30 years, I think 1992, NIH had a women director, Dr. Bernadine Healy, and she was on a mission to change, this heart health for women, because she noticed that for years, in spite of thinking that women were safe from heart attack, and in spite of thinking that everything that was applicable to men would be applicable to women, she, along with others, observed the mortality, the death in women due to heart disease were significantly higher. So there came a push to, promote heart health for women. And there came a push to give government funding, research, NIH funding to, women's specific heart disease. And many of your listeners might have heard of Women Heart Initiative, the WHI effort that is right now quite hot, but which we are going to speak about.
We'll get to that too.
Yes. Yes, but I think a lot of those efforts came from, observing this higher mortality. So now, good thing is, Flora, if you look at today's landscape, there are studies that are specifically designed for women, that are coming out in cardiology world. And anytime any of the medical research in cardiology is presented at these big conferences, one of the biggest inclusion criteria that has to be included in the study is that gender breakup. Right.
Yeah.
So, and it has been such an important part for the study design, as well as, later on when a study is published, a clinical trial is published, it really has to be published in a good journal. And journals are now requiring that breakup of the gender to be, 50-50, if not more, more or less. So I think there is this increased awareness now. So yes, back in the day we suffered, but I do think we have ample amount of data, which is how we understand the difference in physiology, the anatomy of a woman and a man's body. So yeah, that's where we stand. And I do think that not everything needs to be nullified.
Yeah. So, how do women present differently when it comes to not only cardiac risk factors, but actual heart attacks?
Yeah, no, that's a very important question. And I'm thankful to you for, again, bringing this topic, because this is what I live day in and day out. So I think what we know is, for both men and women patients, the most common symptom of heart disease, of the coronary atherosclerotic coronary artery disease, still is chest pain. The problem is that when a woman goes to complain about chest pain, they are heard less. And why they are heard less? Because this is proven again by research, that when a woman presents, not only they have just chest pain or chest discomfort or chest tightness, but also they will have associated symptoms. So they would say that I have chest pain, but I also am feeling, I have nausea and I have dizziness, or I have shortness of breath. So anything between, like literally nose to the umbilical, anything in between, or I have jaw pain. So because of these associated symptoms, maybe part of it gets diluted. And then the other part is that there's definitely, biases that you exist practicing in the field, as far as whether it is our emergency medicine physicians or internal medicine physicians or the cardiologists. None of us are bias free. So a lot of times, there was a big trial called Virgo trial that kind of showed these associations. And what they showed is, when women present, these were young women between 18 to 55 that presented with heart attack. Not only they had higher risk factors, but also they have very high psychosomatic symptoms because of the social pressure, etc. So they come with stress that is very apparent. So guess what? They get blame. What gets blamed for the chest pain? Or you have anxiety automatically.
Anxiety. Yeah.
But what it is, it's the chicken or the egg. Well, actually, it is that stress that leads to that heart disease, and that's a one big thing that gets overlooked, and somehow women get ignored. So in spite of presenting correctly, they get misdiagnosed. There is delay in treatment. There is less treatment given to women. And do I believe that, my colleagues in cardiology act differently? No, I think that they have the same knowledge, but those underrooted, deep-seated biases, come into play. And that's why awareness is so essential.
Absolutely. And, we call it the art of practicing medicine, right? It's rare that patients come in presenting with like this textbook. I mean, it's nice when they do, but with these textbook symptoms, with like the left-sided chest pain radiating to the left arm, they're sweating. And I also wanted to add something really interesting. So I had a family member who had chest pain, and thankfully she's fine. But when my husband and I got involved, we're both in medicine, and she mentioned I was having chest pressure. So when I was asked, was I having chest pain? I said no, because it wasn't painful. and our brains blew up. I had never heard it described that way.
Yeah,
And so for everyone out there, any abnormal sensation should be disclosed to your doctor. This is not a game of semantics. This is a game of your health. And so it was an opportunity to educate, but you don't know what you don't know. So I hope anyone that's listening out here can also pass along the word. And
that is
as physicians and medical providers, we need to ask questions in a different way as well, because semantics do play a role, whether you want to or
absolutely.
not.
And I mean, think about the cultural factors right there, like why the way she perceived, right? Like, there are so many communities and cultures where certain things are accepted and others are not. So if we don't broaden up the way we are communicating our patients, and more importantly, if we don't broaden up how we are listening to our patients, we will never be able to listen to them fully, right? So you're
Yeah.
absolutely right. The Hollywood heart attack, that scene where, oh, I'm going up,
I
I'm
love
having
that.
chest pain, heart attack. That is seen, but not every single patient, would walk in with it. And women particularly don't seem to walk in with those kind of drastic symptoms. They have more associated symptoms. They have more stress. And yeah, we absolutely need to listen to our patients. I often tell my patients that when you have that intuition that there is something wrong with me, even if it is
Yeah.
just, something you're feeling, in the chest, in this area, and you have the risk factors, you have been told that you might be at a higher risk of getting heart disease, and you have that intuition, go present yourself. And there's a second
Yes.
that is empowering, with the example that you were giving, is asking that direct question to the doctor that is discharging you from the emergency room. Are you sure I'm not having a heart attack? Right? Like,
I think that's reasonable. I have patients that come in that are apologizing, like, this sounds dumb, and I always stop them. I'm like, I am here to tell you the difference between, are you healthy and can we stop, versus do we need to do further? So I'm not expecting you to evaluate yourself. That's what we are here for. We are here for you. And I'm also asked, like, are you sure I'm not dying? Are you sure I'm not having a heart attack? Are you sure I don't have cancer? I chuckle, but I also welcome those questions because it does allow me to think more broadly. And also, a lot of it is helping the patient feel better and more
absolutely.
comfortable and more confident that they're not dying. I mean,
Yeah.
that's a legit fear.
Yeah, no, I completely agree with you. And I think I always give that advice to all my patients, that there is nothing like, going to emergency room a lot of times. There is no other way anyone would be able to differentiate whether it is just chest pain that is coming from any of the walls versus it's coming from the heart. If you have the risk factors, if you have been told that, you are at a higher risk of getting heart disease, you gotta get yourself checked. There is nothing more precious, that piece of muscle that beats every single minute 60 times and give the life, that is so beautiful. So I would absolutely encourage all of our listeners, when you have those symptoms, feel empowered to go and present yourself, and feel very empowered to ask those direct questions to the physician that is discharging you. Am I having a heart attack?
Yeah, I think that's completely appropriate. So, speaking of women not only presenting differently, not only having a bias play a role, but we also have, as you had mentioned, completely different physiologies. So, even some of our patients in our 30s, but mostly 40s, 50s, 60s, perimenopause, menopause, these hormonal fluctuations and shifts make us higher risk for heart disease. Can you just overall break that down? Like perimenopause, we're younger, there's lots of fluctuations. How does that play a role versus we are in full-fledged menopause, no more periods, hormones are down, but they're more steady? How does that impact our risk factors?
No, that's an excellent question. So there are a few things that are happening in a woman that is going through a perimenopausal period. I would say I often tell my patients it's the most critical time in being a woman, because the first critical time is when a woman becomes pregnant. So I think what we call in cardiology pregnancy is a nature stress test. And why do we call it a nature stress test? Is because there are a lot of changes that are happening in a woman's body, right? There are changes that are happening in the vasculature. There are changes that are happening in the blood volume. Everything kind of expands and gets bigger because there is a additional life that needs to be nourished. And what we have seen is during this very critical time of pregnancy, if a woman develops, say, glucose intolerance, i.e., diabetes during pregnancy, or high blood pressure during pregnancy, or eclampsia, or preeclampsia, or even any placental issues that is affecting the vasculature. Believe it or not, Flora, placenta, as we know, is a vasculature. And when there are placental issues, that is giving you a signal that you're going to have other vasculature issues in life.
It makes sense. I guess I had everything else on my list, but not placental
Yes.
issues. And oftentimes, again, as an internist, an outpatient primary care doctor, I don't even know if there's placental issues. Like I see the gestational hypertension, I see gestational diabetes listed, but I don't automatically see the plus. I mean, that's OBGYN. So thank you. That gives me a little more of an insight that I might have to do a little more of a chart search and a little deep dive.
So I often ask my patients, if there is placenta previa, was there premature labor?
Mm-hmm.
Why? And this OB history, we actually include in our cardiac history, because what this tells me is that vasculature is at higher risk of developing cardiovascular disease later in life. So, and often why we see our cardio OB patients is exactly to give them that advice that, look, this is what has happened with you. And yes, now those issues have resolved as you have finished your pregnancy, but now let's look at your cholesterol and let's calculate your overall risk in next 10 years because it's going to go up and you want to see your kids' graduation. So we got to make sure that.
Absolutely. This is about longevity for sure.
Yes. So we often do that. And then I think the second critical part, as we were mentioning, is this, whole perimenopausal age. Now, there are two things that are happening in that perimenopausal age. Number one is the overall risk factor. Age is going up. Because the age is going up, there is more, emerge of high blood pressure, diabetes, etc. And these things are just in parallel to age, with both the genders. So that is one thing that is happening. And then the second thing that is happening is this, we call it a protective blanket of estrogen over the vasculature. So all our vessels have this coating of estrogen when we are not perimenopausal. And slowly that coating, the protective coating, has been taken away because we are entering the menopausal age. And that unfortunately changes few things. The vasculature becomes at higher risk of developing what we call the plaque buildup or the atherosclerosis. So suddenly all the fat is coming back into the belly. So a lot of my patients would complain, but I can't lose this little donut I have right here. And that leads to more insulin resistance, again, more diabetes, more inflammation. There is also cholesterol numbers that change. So we lose our good cholesterol, the triglycerides go up, and LDL cholesterol also goes up. So collectively, if we put it all together, because of all these metabolic changes, as well as the estrogen, the protective layer that going away, suddenly a woman becomes at a higher risk of developing heart disease, and much higher. And then it just accelerates from there, right? So then there is no change between a man and woman. Before that, if you look at before 50, we put women in a lower category, lower risk category for getting heart disease. But unfortunately, after menopause, it just shoots up and it is an independent risk factor, the postmenopausal.
Yeah. So I guess message here, go to your doctor, and I'm going to have you talk about how our listeners can kind of take ownership and feel empowered and go to their doctor with certain expectations and asks. But end message is don't take perimenopause, menopause as just, there is education out there. There is help out there. There is a way to tackle this because we can't control when it's going to happen. And obviously, it's going to happen. That's just simple biology. But we don't have to do this passively. We can take ownership of our health, and preventative care is my love language. I'm sure it's part of yours as well. And what changes or what actions can we take now for our 40, 50, 60-year-old version of Purvi and Flora, right? What can we do to stay functional and have a good quality of life in our 50s, 60s, or whatever age, add a decade to that. And so it's important to think of it that way. And also, a lot of the risk factors that you mentioned could be silent. So just because you're quote unquote feeling well, the amount of times I've heard this, I feel well, doc. That's why I haven't seen you in a few years. I'm happy that you're feeling well. However, that's what preventative care is. We want to prevent disease before it happens. And that's where lab numbers and medical history and a lot of things come into play. So I'm happy that you went into that. And so let's kind of go into this, I guess.
Let me just bring a point there because it came to me. So, the funny thing, because your listeners are on social media. So, there are all these TikTok videos I see about, you are between 35 to 40 years. And, you're going to apply retinol because you're going to get wrinkles and stuff. I want similar stuff. Like, why is no one talking? We prepare our skin. We are preparing our skin to be, going through that, right? Like we are preparing that, oh my God, I'm going to be old. I'm going to get wrinkles and let me prevent it. Well, what about the, skin of your vessels, that you can't see? But you know what? You don't want to be ugly inside as well. You don't want all that coating to be coating your vessels, right? So I often joke with my patients that, if you all know your bra sizes, you all know your shoe sizes. If I ask you how much retinol percentage you are applying, you can tell me right away. But then somehow you all don't know your LDL, and that hurts me as a cardiologist. Why do you not know your numbers? And why do you not know how are you going to prepare yourself for this absolutely critical phase of your life that might strip away a lot of things from you if you get a heart attack or a stroke?
That is such a good point. The external, you're right. It's all valid information when it comes to external skincare, so on and so forth. But you're right. The skin on the inside, I love how you did that. I love how you verbalize that. The skin around your vessels is just as important, and preventative care for that is just as important. And so then let's get into that. As a listener, as a patient, let's be honest. I mean, everyone has an Apple Watch, or I have an Oura Ring on. I track my steps. I track my heart rate with exercise. Are fitness trackers actually helping people to avoid heart disease, or is it just digital noise?
I think there are both the sides to it. So when you are at a higher risk of developing arrhythmias, or say, for example, you have sleep apnea and you are detecting an arrhythmia on your Apple Watch. Now, that's a very, very incredible piece of information that as a cardiologist, I would like. But if you come to me and you have 50 pages of absolute noise on your Apple Watch, then of course it's a waste. So I personally feel like you really have to figure out what is the reason why you are investing into the digital tracking. Like I don't wear anything actually because I know what are my vitals, and I don't want to give myself an unnecessary anxiety. And sometimes that's what it is, right? For most of the patients, they'll see something, and in spite of explaining them, they will go on Google, they'll find more information, and they give themselves more anxiety. So I think if it empowers you, absolutely use the gadget to your advantage. But if it is going to give you more anxiety because you're someone that, wants more information and wants to act on every single piece of it, then, I don't think that is very helpful, for anything in life, right? Like some of my patients will obsess over low HDL. Their HDL may be 47, but doc, I want to increase it to 50. And it's really giving me anxiety. And I always tell them what kills you more is your anxiety that it's
absolutely
with this 3.
I say the same thing.
Yeah, right.
I say the same thing.
Absolute. Yeah. So I think it's all about what empowers you, and how you're going to use that information.
Do you ever feel like you are juggling a million things at once? Especially if you are a business owner. You're trying to grow your business, but also, run your business. It can feel like you are drowning in your to-dos with barely a moment to breathe, let alone dream bigger. I have been there. Now, look, I tried hiring a gamut of virtual assistants, but it often felt like there was just one other thing on my to-do list. I had to spoon feed tasks, constantly check in, recheck their work, and still worry about things slipping through the cracks. It wasn't until I found Savannah and Natalie at Everay Virtual Solutions that I truly understood the difference between help and the right kind of help. They have extensive marketing, development, and executive assistant backgrounds so they can take the weight off of your shoulders so you can focus on what you do best, being the visionary. Book a free discovery call on their website and mention this episode for a 10% discount for your first 6 months. Head over to everyvirtualsolutions.com. That's EVERAE virtualsolutions.com. Whether it's web design, content creation, email management, social media, PR, or anything in between, I know you will find a way to work together to lighten your load. It's time to end the burnout and start focusing on you. It's important. I think there is a balance that we need to strike between what will make us feel confident versus stressed.
Yeah.
That's one of the reasons I actually gave up my Apple Watch. I didn't want that extra digital noise. I was very interested in my sleep hygiene, which plays a role in my stress management and my ability to take care of myself, my mood, everything, which then obviously goes back to cardiovascular health and nutrition, diet, habit stacking. So I think that's where my tracker has helped me. And then steps. So I do workout almost 5 days a week, but the remainder of the time I'm actually relatively sedentary. And so it really brought that to light too, that I'm sitting for longer than 60, 90 minutes at a time. And there are some days that I'm taking less than 5,000 steps. So I know there is no magic number because I know that has been debunked, but I usually recommend to my own patients not being sedentary technically means not sitting for longer than 90 minutes and getting more than 5,000 steps. Is that something okay for someone to aim
That's
to?
an excellent question. So I think that 10,000 steps, I'm sure you know the story. It was invented by, a Japanese odometer company that was trying to figure out, what they were going to do with the product. And then somehow it stuck in the, our guidelines, etc. Now, the thing about 10,000 steps or any activity is we know that any activity is good activity. And that's where your trackers are absolutely essential. It will remind you to stand up. It will remind you to walk around. It will remind you to take a breath in. So it will also remind you to drink water, right? Like some of these smart water bottles, etc. So I think I absolutely love that information for my patients. I think that what I tell my patient is, as much as you can do, it never goes bad. But also, if you're busy, say, for example, you have a very challenging job where you cannot find any time, and you need to know how much you can walk in a day and how many steps it's going to be, and then just divide it by 5 times. Rather than walking 1.5 hours, just take 20 minutes break, 3 times a day, right? Park your car away, so that you can make those extra steps. Compete with yourself to make those steps,
Yes.
and you will get there. And then the other important part, a very beautiful paper came out recently that I had posted on my social media. I think it was in JAHA, that showed that even if, say, for example, you are commuting the entire week and you don't get any time to do any extra activity, but then those weekends, Saturday, Sunday, Friday, Saturday, Sunday, you have scheduled time and you are that weekend warrior who's only exercising during weekend, you still see the benefit of exercise. So I think whether it is small chunks of exercise, big lump of exercise, however way you want to move, you need to move. That's the point. And I for my patients that are elderly and in this socio-economical status, I practice in San Bernardino County. I give them simple ideas that just take breaks and
Yeah.
go in the lunch break and walk around, go outside, sit in the sun, have your meal outside, walk around, and then come back. So I think small little things might help, but that only comes when there is awareness. So in general, 10,000 steps are good. Anything less than 10,000 step is good. Anything at all is good. So whatever they can do is good. Basically, move.
Thank you for breaking that down. Exercise and nutrition is not an all or nothing mindset. Anything is good, and scheduling it in, blocking it out, because not having time is an actual reason. However, the majority of the time, I'll have my patients or even my coaching clients do a time audit of their week where they're writing down what they're doing for how long. Talk about binging Netflix, doom scrolling on their phones. That in itself takes away probably a minimum 1 hour. Not saying that's a bad thing. I'm human. I do it too. But to say that you don't have time, but you do have time for that, it just puts things into perspective that, you do need to block out non-negotiable time if you're able to for movement. So, okay, we kind of did the exercise thing. Let's go into the nutrition box. In general, what are foods we should eat more of and foods we should maybe cut back on?
Yeah. So let's start with the cutback part. Absolutely. My number one is all this ultra processed foods that are available in the market. I think that there is a lot of data to suggest that they're not good. With their fructose content, with all the additives, with how they spike the insulin, spikes and high glucose, etc. I think the good food are, whatever nature gives you, the way it gives you, right? So I only buy stuff from farmers market because I really like the way, the produce is coming there, right? So all the green leafy vegetables are very good. All the fruits, not the sugary ones that everyone wants to eat, like, like the banana, the
Melons,
mangoes.
bananas.
Yeah. Yeah.
Oh, mango season's coming too. I'm
No, and it's so hard to remind like everyone back home in India that, okay, just remember you're diabetic. You cannot have that many mangoes. But, berries and cantaloupe and fruits that are nutritious. I'm a plant-based, person, and I know you are as well. So I don't eat any.
I'm actually not plant-based.
Oh, wait, sorry. I think when we were together, you had veggie stuff. So I just assumed.
I did
Yeah.
fill my plates with vegetarian stuff that day when we were just as a little bit of background for our listeners, we were at the same conference, and a lot of the non-vegetarian options were based in lots of butter and oil, and I am very cognizant of what my intake is, and there wasn't anything that was grilled, and so I loaded my plate up with veggies, and I had a lot of protein for breakfast because that's usually what I expect for
I see.
conferences.
Okay.
But anyway,
Yes. So that you brought up a great point, all the saturated fats, right? So all the butter, ghee, for all your South Asian listeners, and
yeah.
oils, try to avoid them. And even with the olive oil and avocado oil, try to limit the quantity, how much you're going to have. Yeah. So I was going to say, yeah, red meat, absolutely not. Chicken and seafood, particularly fish, fish
Yes.
is good, as we know. And, the whole grains are good. All the lentils, wheat, bulgur, the way it is given again, it's good. Everything that has been polished and ultra processed, that spikes our sugar level quite high. It gives the insulin spike as well. So try to avoid those. So I think in general, if you put the food category and the processed and, ultra processed and natural, I would go everything natural. And I would
Yeah.
avoid, all the saturated fat sources, including the milk and the oils as well as the meat.
What about all the non-dairy alternative options? I know like coconut is very high in fat, but almond milk, oat milk, obviously oat, well, I guess that would be considered processed, yes?
Yeah, I mean, I don't use any of the milk alternatives as such. Oat milk does have high fiber. It is processed, but in the sense that there's no additive in it.
Got
But
it.
I generally, I don't have coffee or tea generally, so I think
Girl,
I'm
you are doing so much without caffeine. I'm impressed. I need my cup of coffee a day, but I just use a little bit of almond milk. I actually don't use
Yeah,
creamers or
I just
anything.
recently, stopped everything because I was having some palpitations, and it's been very good 3 months, so it's been very good.
Good for you.
I mostly crave the taste rather than the buzz,
I
so
think it is a little bit of a psychological,
yeah.
because as soon as I feel that coffee, I'm like, oh,
There
I
you
can
go. You
start
wake
my
up, right?
day.
Just the smell of it wakes you up. Yeah, yeah.
Are there any, you went through so much, so thank you for going in so much detail. Are there any surprising foods or ingredients that we should maybe gravitate towards that's really not advertised or mainstream,
Mm.
or foods or ingredients that we should cut back on that are heavily advertised and mainstreamed as like healthy?
Yeah, so I think, yeah, I have so many that I discuss with my patients. Like all these whole wheat breads. I mean, you think that it is whole wheat. No, it's refined flour, right? So they call it whole wheat, but it is not wheat, and it's still refined. Same with fruit juices, or protein bars, right? A lot of protein bars have like super heavy sugar content. Protein shakes that come, look at the sugar content and you'll see how much sugar they put in. What else? Oh yeah, all these ultra processed vegan stuff like meat substitutes and stuff. Look
Yes.
at it, the way they make it, it's not very healthy, and the way it is advertised as if it's like the best thing. So I don't.
And the sodium content, I'm shocked
Yes,
at a lot
yes,
of these substitutes,
yes.
and they're pre-marinated, and they all of this, and it tastes yummy, but the amount of salt, I can feel my legs swell, or I
Yeah.
feel a little bit swollen after I have a lot. So
Yeah,
yeah, that
no, you're
makes sense.
absolutely right. The same thing you mentioned, coconut, anything with coconut, right? So saturated fat. So if you go like plant-based yogurts, and, all of them have coconut, and coconut has very high saturated fat, or coconut milk in general. So I think try to avoid that. Again, is thought to be, oh, it's an alternative to dairy and it has to be healthy. It's not. Um,
There's so many food types and groups that have been demonized. I know growing up, carbs were bad. The Atkins diet, that was the craze growing up. And that's what I had, like these subliminal messages in the back of my brain that, don't have carbs because carbs are going to make you fat, when in reality, whole grains, true whole grains,
yeah.
is the way to go. Now, I always tell my patients, just because something is advertised as whole wheat or a whole grain doesn't mean it actually is. So flip the package over, look at the ingredient. That first ingredient should be whole wheat flour. Otherwise, it's likely refined processed, meaning it's the seeds broken down and then
Yeah.
repacked again.
Yeah.
Is that okay to, like,
Yeah.
an okay piece of advice to give people?
Yeah, I mean, I think again, Flora, it comes down to think about how many times we have brought awareness, right? It all comes down to awareness. If you are not taking control of how much you are moving, what you are cooking, how you're cooking it, this game you can never win, right? Because there is so much. I mean, you just go in a supermarket and you see what, I'm sorry to
It's
say,
overwhelming.
what they are selling, right? Like, it just makes me sad. I'm like, I cringe every time I see people pick out, right? So again, empower yourself. Look at the labels and
Look at the
see,
label,
see
not
what you are.
marketing.
Yes, see
Yep,
what you're putting in
absolutely.
your. Don't listen to the influencer. They got some money to, like sell something, So just empower
Absolutely.
yourself. Yeah.
Absolutely. So let's move to our listeners going to their doctor. They're going to their general practitioner, they're getting their physical annual exam. What should they, I can speak to what should they expect, but aside from all the basic stuff, what should they tell their doctor, and something that's really not well known? So they go to their primary care doctor, and the primary care doctor goes through everything. I usually catch a lot of stuff because I ask in different ways and I make sure I address it. But as a patient,
Yeah.
what is something that isn't commonly known to be brought up to their doctor that they should go through in detail with their primary
Yeah.
care?
I think one most important thing that I can tell our patient is just ask your doctor again a direct question about what is my risk of getting a heart attack and stroke, right? And generally that would mean that the doctor then has to go through different risk factors, what they may or may not have, needs to go through the cholesterol check and speak about their overall risk because of their family history, their age, their risk factors, etc. And that's the most important thing a patient can ask. Um, and I think then if you think about it more importantly, getting that information and just having it with you, right? Like what is your blood pressure? What is your cholesterol? Not just it is good or bad, because see, for physicians, someone might call a LDL good, which is not a good cholesterol, which is not a good number for me as a cardiologist. So what is exactly that number? And asking direct question about what is my risk depending on that number, and how low should I go, and what can I do to bring it further lower. So I think those direct questions about what you can do if you're completely healthy and you have taken care of other screening and stuff, take care of this one particular part. What is my waist circumference? How much overweight am I? I'm entering this age where what should I expect if I'm, if you are a perimenopausal woman and going to a doctor, with during that period and everything comes out okay, what should I expect? And what does my metabolic profile should reflect like if I'm considered healthy, right? So asking those
That's
direct
a good point.
questions is
That's
important.
a good point. Before we get to the rapid fire, I have one last question. So you've seen hundreds of female patients. What is one or two underrated but very powerful lifestyle change that actually moves the needle towards better heart health?
Yeah, so I'll give you two that have been, high up on my list. Number one is strength training. There is more and more data coming on about strength training and how it helps the women, really help with that gaining that muscle mass. It has been associated with longevity, better heart health, etc. And the second most important thing I would say is the stress reduction. Stress is a very important risk factor for cardiovascular disease. And whenever, if you think about when a patient goes to a physician, most of the physicians are not advising meditation and breathing exercises, etc., for
Yes.
stress reduction. And to me, that is one of the most underrated, impactful, interventions that we can give our patients. Just to give you a perspective, there's so many studies that now mindful meditation is in AHS guidelines, right, for the intervention to prevent, heart attacks and stroke. It decreases your blood pressure, it increases your heart rate variability, it gives you a better metabolic profile, it, increases, regulates your sleep in a different way, it regulates your heart rate, and it controls the arrhythmias. So there's so many good advantage. It controls the impulse control, right? So overall your behavior is different, and you have better control over your life, you have more awareness towards things. And that's the third time I'm going to mention awareness, because awareness is everything to me.
You're absolutely right. And that's one of the reasons I went into mindset coaching, is because it affects so many aspects of our life, physical and mental. And without getting a hold of that, I think it's just this domino effect on our physical health. And that's what I was seeing in my primary care practice. So it is really incredible that you do take the time, even as a specialist, by the time patients come to see you, that you're working on preventative care and lifestyle, like true lifestyle measures, versus throwing medication. Now, there is absolutely a time and place for medication to prevent, medication to treat. But I think it is definitely more of a holistic approach, regardless of whether you need medication or not. Okay, so I'm going to move to the rapid fire questions. So these are going to be short questions with yes, no, 1 word, 2 word answers. And most of the time, we never stick to 1 to 2 words because
That's
I'm
very
always.
hard. I love
It is hard.
I love
That's why I love doing it.
You are telling
Me too. So I have a feeling we're going to be expanding on a lot of these things. Okay, first question, Purvi, are you ready?
Yes.
If you currently weren't a cardiologist, what do you think you would be doing for your career?
That's easy. Chef. I'd be a chef.
Oh,
I love
really?
it. Yeah, I gotta tell
You should come out with a cookbook.
Oh, I would love to do that. Yes. I just wish
that should be your next. Okay,
time.
we figured it out. I do want a percentage because I came up with the idea. Okay. What is your guilty pleasure?
So I really don't have a sweet tooth, and I've gotten rid of a lot of things in my life that, I feel like can control me, but I love dates. So I'll give you dates. And one of my friends.
Okay, that's not bad. That's not bad. Dates we can do.
Yeah.
What is more dangerous for female hearts? Stress, sugar, or fat?
Stress. Absolutely.
Okay. Stress. After our talk, I thought you were going to say that.
Yeah.
Coffee, good or bad?
Bad.
Alcohol, good or bad?
Bad.
There's so much more research coming out on alcohol.
Yes.
What is a heart health myth that just makes you cringe?
That you need cholesterol in your body. And red meat.
I don't think I've heard. Wait, what do you mean by that? Let's talk about that.
There are so many social media posts that your LDL cannot go very low because LDL is a building block of your body. You should listen to that. There are a lot of people.
Can you tell me a little bit about that? Wait, I'm so confused.
Yeah, so there is. Oh my God, you're talking. I think all the keto community is gonna come behind us, but there is a JACC.
No, we're good. We're good.
Yeah, there is a JACC paper that recently got released where, and so you're absolutely right. LDL, when it goes up, you gotta treat it. And a lot of these diets, when people consume, a lot of red meat, etc., the LDL goes up. And what in this study they did was they tried to measure the plaque that was there in the heart vessels when these super healthy people in their before I think they were in their 50s started using the keto diet, and what they showed was that LDL, I guess their conclusion was not very sophisticatedly put, but nonetheless they showed that the plaque buildup in these people went up, and although it did not correlate with the LDL increase. But what we know, I don't want to confuse your listeners. What we know is that yes, cholesterol is essential in some building blocks of our body, but the excess cholesterol is not good for us because it leads to that plaque buildup, right? So, Flora, this is the area in cardiology that has been studied the most. Statins are the most studied medicine in the world. Okay. No other amount of research even equates any other department you take, right? Any other specialty you take. We know so much about statin. It really, I cringe when I hear patients say that, well, I need that cholesterol because it is my building block, because they heard some influencer talk about it on TikTok. So that myth really, it gets to me because
it gets I can tell. I haven't heard that from my patients, but now I need to go educate myself because I know the question's probably going to be coming at some point in time. And there is a lot of naysaying around statins. And look, no medication, whether it's a prescription or over-the-counter herbal supplement, nothing comes without a potential risk, right? You could eat a natural food and have an unknown allergy and develop an allergic reaction. We're not doing anything without risk. And I always remind patients of that.
Let me tell you that I cite this for my patients. When they did the nocebo trials for statins, right? When they did these trials where they gave, patients statin or placebo, everyone got the side effects of statin.
Yeah.
Everyone.
I remember that.
Right?
Yep.
So I think a lot of this is so much of what media is doing to us and our patients, right? To our society. Placebo is such an important factor that we forget. Our minds are very, very powerful. So I always tell my patients that, look, these are the side effects that are described, but I just want you to know that your mind is the most powerful thing. So if you decide that this medicine is going to give you side effects, don't even take it, because I know you're going to get side effects.
I'm going to steal that. I'm going to say that to my own patients, that I can't change your mind. You can only change your mind. I love that. Purvi, I think we could talk about this forever. I'm going to have you back at some point to debunk more of these crazy myths. I just learned a new one, but thank you so much for being here. And for the listeners who are interested, where can people find you?
People can find me at Loma Linda University Health. I'm a physician here in, the only blue zone in North America. And I'm also on, I think I'm on Instagram, not as active as you are. I mostly use it whenever I have time. And I'm also on LinkedIn and X, so they can, find me virtually as well. But yeah.
We will link all of that in the podcast information page. So if anyone wants to go see Dr. Parwani as a patient or follow her on any of our social media platforms, you can go do that with a simple click. Well, Purvi, thank you so much for taking the time. I know you are a busy, busy person, and I appreciate you taking the time to help educate and empower all of our listeners here.
And thank you for giving everyone the platform. I mean, I had so much fun chatting with you, but more importantly, our patients and listeners can go. And I'm so impressed by how multi-talented person you are. You're an excellent physician, but I tell you, everyone listening, you're so organized. I'm so impressed by your tech abilities. So you are a superwoman. So I admire you. I admire your energy. And thank you so much for creating this platform for everyone, so that they can come and listen and learn.
You are so sweet. Thank you for those kind words. I do have to say I'm not doing this alone. So shout out to my team. You guys are amazing. And thank you for keeping my crazy brain in check here. All right. Well, to all of my Beyond listeners, thank you so much for being here. And just remember, this podcast is a two-way conversation. So I would love to hear from you. Dr. Parwani wants to hear from you. If something in today's episode resonated, if you learned something, DM the both of us, tag the both of us, post us on your stories. And if you found this episode helpful, the best way to support the show is hit that follow button right now. Like, go do it right now on your listening platform. Write a review, do a rating. All of that will help the word get out. And again, don't forget to share this. Share this with your mom, your sister, your auntie, your friend, any female or even male companion, I think would find this incredibly helpful. So let's continue to help each other to live beyond our labels, beyond our boxes. Truly, your support means the world. Thanks for tuning in. And as always, remember, mindset is medicine. Keep showing up for yourself, and I'll see you next time. Bye. Thank you so much for joining and spending your precious time here with me. As someone who prioritizes her energy, I am so grateful that you chose to spend yours here. To help me help you, please take an extra 30 seconds of your time to rate and review the podcast on your listening platform. For more tips and a behind-the-scenes look into my life, follow me on Instagram at Dr. Flora Sinha. That's Dr. Flora Sinha. Finally, connecting with you truly fills my cup. So DM me on Instagram, email me at florasinhamd@gmail.com. Repost if you love this episode. I love hearing from you. I am so grateful for you and cannot wait to be back for the next episode. Bye.